Arogya Expo and Ayush Conclave 2026. I welcome you all for this paper presentation session. The first session would be the PG session and followed by the UG session. To guide and support this session, we are fortunate to have our chairperson and co-chairperson, and I will request our chairperson Dr. Hariharan sir to occupy the dais, please sir. Along with the chairperson, I request our co-chairperson Dr. Dhanvantri sir to occupy the dais. Thank you, sir. So the paper presentation would be a 6-minute presentation. You will hear a buzzer at 5 minutes, and as well as after 1 minute you will hear another buzzer and 2 minutes for discussion. I request the candidates to kindly stick to the timings and make your presentation crisp as possible. Now let us move on to the first paper presentation. I now request Dr. Divya Rajendran for her presentation.
Good morning, respected dignitaries. I am Dr. Divya from Department of Kaumara Vidya from Shree College of Ayurveda, Bangalore. This presentation analyzes the role of Anavaha Srotas in childhood anxiety and integrated approach from both Ayurveda and modern gut brain emphasizes. So, these are my contents. Anxiety has become a global problem, and even in India, the whole prevalence of Indian adolescents with anxiety has become 21 to 41% according to the researchers. And why is it important? Because the core clinical concept is that, according to studies, around 40% of children with anxiety have increased functional gastrointestinal symptoms than just 5.9% in the non-anxious children. This concept is not new to us because in Ashtanga Hridaya Nidana Sthana, Acharya Vagbhata has explained that Roga Sarvayapi Mandana. So, are we missing the cut while taking a mind? That is the question we have to be knowing in these pillars. Coming to the Ayurvedic concept of anxiety, the Chitta Udvega term is a coined term meaning the Chitta which has been Udvega, that is the agitated mind, and it is a Manasika Vikara which comes from the Raja and Tamoguna vitiation. And according to Acharya Charaka, Udvega is a Purvarupa of Unmada, and with this we can get to a conclusion that Udvega is a preclinical symptom of progressive Manasika Vikaras. And when you look into this Samprapti of Chittodvega, you can see that Manodushti is also connected with the Agni Vikriti and totally leading to Chittodvega. So, from this we can conclude that Mandagni is a second trigger for anxiety. And role of Anavaha Srotas is explained here because Amashaya is the Molasthana of Anavaha Srotas as explained by both Charaka and Acharya Shushruta. And we know that Jagaragni is present in Amashaya, which has these functions like Ahara Grahana, Avastha and Anarasa Nirmana. And this Anavaha Srota Dushti, if Anavaha Srota is having any Dushti, these lakshanas can be seen as explained by Acharya Charaka, and it can be compared with the behavioral issues which we can see in anxious children, which can be related to the gastrointestinal symptoms like poor appetite or abdominal bloating. And finally, we can compare Marana with this severe systemic depletion if untreated. So, in modern also this has been compared with the gut-brain axis now, which is becoming very popular in the studies and everything, where we can see that the normal microbiota which has the normal symptoms, and in the abnormal microbiota where there is dysbiosis or any immune deficiency, there will be symptoms of anxiety, and which can be compared with the four pathways which is neural, endocrine and immune, and also microbial gut-brain axis, which acts in the with the vagus nerve and is connected with the brain. So when the child comes with anxiety to us, the first line of treatment should be Deepana Pachana, followed by Shroto Shodhana, then Oja Vardhana, and Sattvavajini Chikitsa should be given along with all of this, like integrating with cognitive behavioral therapy, which we can give in the children with anxiety. So if we give Deepana Pachana, the first the appetite is normalized, which gradually improves the Anavasrota Drushti Lakshanas like abdominal pain and bloating, and this increases the attention span and ultimately reduces Chittodvega. These are some drugs which can be given in children with anxiety so that Dipana Pachana occurs and this affects in the Chittodvega also. Like for example, the Tripatachurna can help in mana, heaviness and even mental dullness. And Drakshadilenium, Kushmanda Rasayanam, everything improves Nidra and ultimately reduces the Udvega in children. So I just want to conclude saying that childhood anxiety is a psychosomatic manifestation of Annavahasrota Drushti, and digestive symptoms are early indicators of mental imbalance. Reduced weight and tone in anxious children disturbs gastric motility and emotional regulation, conforming to the gut to mind brain pathway as described in Ayurveda also. So with the correction of Agni, we can prevent chronic anxiety and reduce relapses in children, so that if the child grows and they have any issues in when they are growing in the school, or even from the childhood, if they have any separation anxiety or school related, test related anxiety, we can cure with just curing the gut. Thank you. Yes, many clinical studies have been done in modern sciences, but in Ayurveda there are not much studies which has been done in modern sciences. There are references for this where they have found that 40.7% of children with anxiety are suffering with functional gastrointestinal symptoms, and in non-anxious children there are only 5.9%. We can do, sir. We can. Yeah, we can do that. But in children, in our hospital, we don't go much for blood reports and yeah, that can be done, sir. Thank you.
Thank you. I now invite Dr. Arogya for her presentation.
Good morning, respected dignitaries and to all present here. Myself, Dr. Arogya, second year PG scholar from Department of Prashastra and Vaishya Kalpana, SJS. Today I am here to present on the topic exploring green synthesis of iron nanoparticles using ashwagandha extract in the management of chemotherapy-induced myelosuppression. So, chemotherapy-induced myelosuppression is one of the most common dose-limiting and potentially fatal complication of cancer treatment, with estimating occurrence rate of 97% in breast cancer patients undergoing chemotherapy. It is a frequent complication of cytotoxic chemotherapy that results from damage to hematopoietic stem and progenitor cells in the bone marrow, and it manifests as neutropenia, anemia, and thrombocytopenia. Further symptoms such as fatigue can be seen, which gives a negative impact on patients' quality of life and impact their ability to continue the treatment. The conventional management of chemotherapy-induced myelosuppression often involves the erythropoiesis-stimulating agents or iron supplementation, which are associated with adverse side effects and poor bioavailability. So, nanoparticles are extremely tiny particles who have high surface area to volume ratio, gives them unique properties and high reactivity, making them valuable for targeted drug delivery. So, one of the iron nanoparticles are the tiny nanoparticles with unique magnetic catalytic properties, having high surface area and making them useful in drug delivery, and often iron oxide base can be synthesized via green synthesis. Ashwagandha is a rich reservoir of bioavailable iron and potent source of bioactive phytochemicals including phenolics, alkaloids, flavonoids, etc., which exhibits antioxidant, immunomodulatory and hematopoietic properties. Aim is to explore the therapeutic potential of synthesized iron nanoparticles from ashwagandha root extract in the management of chemotherapy-induced myelosuppression. Objectives is to critically review green synthesis approach of iron nanoparticles using ashwagandha root extract and to analyze their role in targeted drug delivery. So, as you see, myelosuppression is a complication of chemotherapy and it leads to reduction in WBC, RBC and platelet count. and leads to neutropenia, thrombocytopenia, and anemia, which presents with fatigue, dizziness, tachycardia, dyspnea, which leads to dose reduction in chemotherapy treatment and may lead to discontinue the treatment also. So the green synthesis of nanoparticles is an eco-friendly approach using natural compounds to produce non-hazardous nanoparticles with enhanced bioavailability. So nanoparticles has a capacity to discriminate between the potential target pathogens and the normal cells. Iron nanoparticles are having unique magnetic and catalytic properties which enable them to bind to various biological molecules. And ashwagandha is widely used for this and with therapeutic purposes which contains vitamin, vitaloids and flavonoids. As per previous research, Douglas fruit extract of ashwagandha has total polyphenolic content of 24.07% and iron content of 883 ppm. The synthesis of iron nanoparticles goes like first the preparation of fruit extract has to be prepared and then extract is to be reacted with iron chloride solution and then characterization of iron nanoparticles is done using FTIR, UV visible spectroscopy, etc. Into discussion, these nanoparticle delivery based systems serve as effective carriers and the vitaloids and polyphenols, the components present in the ashwagandha, acts as reducing and capping agents, which enhances the targeted drug delivery. So, coming to the conclusion, the synthesized nanoparticles promote erythropoiesis and bone marrow regeneration by restoring iron and reducing oxidative stress, stimulating cell proliferation. Thank you.
Thank you. Why ashwagandha was selected for this study?
So ashwagandha has flavonoid compound and polyphenols, so it has better action in reducing and capping agents. So it helps in stabilizing and the compounds, iron nanoparticles. It helps in stabilizing and it also proven has immunomodulatory antioxidant properties. So I have taken this. It also has iron content, which may support in anemia. No, sir. This is a proposal.
You can explain a little more about that short. You can present some more clinical evidence about that short. Because we are PG student. So you have more knowledge. There's a lot of research in ashwagandha. Past 4 years after the COVID, lot of the doctors are doing more research on ashwagandha. So you can get a lot of papers and you can explain a little more about the nanoparticle. The things with this. Good, but we'll explain it more. Because we can explain more about the ashwagandha now. Thank you.
I now invite Dr. Shree for her presentation.
So good morning. Good morning everyone present here. I'm Dr. Shree from the Department of Yoga and Naturopathy. I'm a PG scholar, final year. So my topic is impact of yoga and naturopathy on inflammation and functional mobility in ankylosing spondylitis. It's a case report. So coming to the introduction, ankylosing spondylosis is known as a chronic inflammatory condition that mainly impacts the axial skeleton, particularly the sacroiliac joints, spine, and leading to pain, stiffness, and reduced joint mobility. So as of now, there is no clear etiology for ankylosing spondylosis, and the conventional treatments it differs on mainly non-steroidal anti-inflammatory drugs and corticosteroids, which will produce drug resistance, and going on to biological inhibitors like TNF alpha, which may also have converging adverse effects. So upon the study, we can see only the conventional treatments as of now is NSAIDs and inhibiting factors, which are not a permanent solution for ankylosing spondylosis. It's just a time while pain management. So my objective is to study the impact of integrated yoga and naturopathy treatment on inflammation and functional mobility in ankylosing spondylitis. So case description, it is a 34-year-old male diagnosed with AS-HLB 27 positive in 2018. So his complaints was reduced range of motion in hips, neck for past 6 years, and he is unable to sit down with folding with folded legs, and also he's disturbed during his day-to-day chores. He's a IT employee, so his day-to-day life and quality of life is very much affected. So on examination, locomotor system, gait is restricted gait, and legs he has stiffness in the hip joints, and spine there is a loss of lumbar and cervical lordosis, which results in restricted range of motion. So on investigations, of bilateral sacroiliac joints, so which is a key factor for ankylosing spondylitis, and his lab investigation on September 29, 24, ESR was 50 mm per hour and CRP was 47 mg per deciliter. So this is the patient's timeline. So he was admitted in our IPD on September 2024 for 10 days, and 45 days of home follow-up was given. And again second admission on November 2024, 10 days admission and 60 days of home follow-up, and third admission was on February 2025, again 10 days, and post markers were taken on March 24, 2025. So these are the assessments which I have done. So laboratory, I have for inflammation, I have taken ESR and CRP levels. For neck mobility, I have taken occiput to wall, lumbar function test like lateral bending, modified Strober's test, and intermedullary distance, and chest measurements, inhalation, exhalation, neck disability index. 2 questionnaires, ankylosing spondylosis quality of life, and BATH ankylosing spondylosis disease activity index. So these are the treatment protocols. In our IPD, we give 2 sessions of yoga per day, and in home also, in home follow-up, I have asked him to do every day 1 hour yoga. So asanas, Pawan Muktasana series, chair Surya Namaskar, Adya Titli Asana, Janu Sirasasana, Tadasana, Trikonasana, Uttan Padasana, Sedu Bandasana, Shavasupta Udrakashanasana, and meditation, instant and deep relaxation technique, Avu Im, chanting, Pranayama, Nadi Shodhana, Brahmari, and Kapalpati. So hydrotherapy, I have given neutral spinal bath, cold hip bath, alternate compress, partial massage, mud pack, full mud bath, plantain leaf bath, full body massage along with steam bath. So acupuncture, I have given electro acupuncture on the points UB11, stomach 36, K3, spleen 6, and acupuncture on liver 3, spleen 9, GB 34, UB 40, DU 20. Points were selected based on Chinese pulse diagnosis and clinical points based on his symptoms. I have also given oil cupping to lower back. Our HIP has a protocoled diet of calorie restriction with morning 7 a.m. of plant juice like ash gourd, plantain pith, and bottle gourd. 9 a.m. will be giving veg and fruit salad along with some sprouts. 12 a.m. will be giving fruit salads, fruit juices. 12 p.m. fruit salad and sprouts. 4 a.m. will be giving any green juice, and 7 p.m. the dinner will be veg salad and fruit salad. So coming to the results, this was the pre and the post. So hospital wall index reduced from 4 to 2. Lateral bending from 61, it decreased to 58 and 59. So Sober's index from 18 to 20.
Time up.
Okay, I'll just only explain the inflammatory markers, which is the main thing. So ESR from 50, it reduced to 10, which is all, it came to normal, and CRP from 47 to 6. So this will be the discussion. Mainly we focus on anti-inflammatory because we have to reduce the inflammation, improve blood circulation, and for pain, analgesic effect which from hydrotherapy, and our plant-based diet, which is obviously anti-inflammatory and antioxidant.
Thank you. You have mentioned about HLA-B27 positive.
Yes, sir.
What was the quantitative levels?
Sir?
The level of HLA-B27, you have given it is positive.
Yes, sir.
What was the level? Value.
Sir,
Was-
value.
Was it a quantitative analysis?
That's a 2 type of analysis. Normal plus
Yes, sir.
positive, negative. Another thing is the value.
Sir,
Value reduce only, that's a clear positive.
See,
Yes, sir.
CRP and ESR are inflammatory markers, that is there. elevated in any kind of inflammation or inflammatory condition, even in infections and other things.
Yes, sir.
You have mentioned HLA-P27 positive.
Yes, sir.
You should have some values now.
Yes, sir. But when he came the report, it was written only in, he had just only photographs because he missed all those files when he was shifting. I just got one photograph of that. So I was not able to get that value.
Thank you.
I now invite Dr. Swati for her presentation.
Good morning, everyone. Respected Chair, Co-Chair, and dear delegates. I'm Dr. Swati C, Associate Professor in the Department of Prasuti Tantra and Sri Roga from Sri Jayendra Saraswati Ayurveda College and Hospital, Chennai. Today I'm going to talk about, my paper is about Ayurvedic management of Vandyatva following thyroidectomy and ART failure, a case-based clinical insight. Introduction of the background. As we all know, ART success rate remains stagnant for about 30 to 35% per cycle globally, despite technological advances. Increasing implantation failure and poor embryo competence are observed even in women with regular ovulatory cycle, normal hormonal and metabolic profiles, no structural pathology on imaging, normal semen parameters in the partner. This trend highlights functional infertility, which is a subtle, often unmeasured disruption in the reproductive microenvironment. So my patient, 35 years female, prior spontaneous conception, who had a full-term vaginal delivery 5.5 years ago with a healthy male child. She was affected with papillary thyroid carcinoma in the year 2023. She is on a regular Thyronorm 125 mcg per day and maintaining a clinically euthyroid state. Despite multiple ovulation induction and one IVF cycle, which has yielded a mosaic embryo, that is the embryo which was not suitable for the implantation, her HSG, hormonal profile, metabolic lab patterns were all turned to be normal. Symptoms during the menses were highlighted with severe headache, which we can call as a menstrual migraine, increased bowel frequency, something which is related to the Grahani type of symptoms were noticed. Systemic regulatory disturbances is what we can identify in the patient involving metabolism, signaling and microenvironment insufficiency. Aims and objective of the current case. Here, the main aim of the case was to understand and to correct the Agni and Grahani Dushti, normalize Apana Vayu Gati, support the Artavadhatu, Garbhashaya Kshetra and the Bija, reduce Manasika Doshas and Ojakshaya. How did we work out on the case was to understand the Samprapti in the view of Dhatukshaya, reason being the thyroidectomy, causing Agni Mandya Vata Prakopa and Apana Vayu Vaigunya related to the menstrual migraine during the periods and the Grahani type of symptoms. Vata Pitta Dushti and also the Bija Dosha expression were also identified in view of the mosaic embryo. Key Nidana being again the thyroidectomy, artificial reproductive technology related stress, sedentary lifestyles and also the irregular meals like Agnimandya, Anashana and Agnimandya factors. Chikitsa phases again included working on her Agni and Apanavayu correction, Vata Shamana and sleep regulations, ovulation support and the Kshetra support. So how did the treatment plan work here was, we reframed the whole body regulatory model, not only focusing on the symptoms, but as a patient whole, working on her Agni, improving her metabolic factors and the mitochondrial efficiency. Vata regulation was also done by understanding the neuroendocrine immune signaling and hemostasis. Dhatu balance again to focus on her thyroid functions as well. This target functions optimization, not just the anatomy, offering a complementary strategy to improve the natural conception factor. So the system model which addressed was focused on her improving the Agni there, stabilizing the HPO axis, uterine perfusion and immune tolerance. Dhatu imbalance worked on tissue competence and making a oocyte cytoplasmic quality and endometrial receptivity, which turned out to be a reduced oxidative stress, inflammation and microcirculatory insufficiency, and which has led into a positive pregnancy in her case, with the beta HCG being 7,609 on 4th day of missed periods. Discussion. What we have done here was Agni restoration, again working on Rasa Rakta metabolism, supporting a nutrient follicular microenvironment. Apana Vayu Anuloma was resolved. Rasayana and Srotoshodhana reduced oxidative, inflammatory and cellular stress burden in the patient. So the treatment plan mainly was, we first focused on advising her with Deepana Pachana dravyas like Arogya Vardhini Vati was advised, Avipatikara Churnam was given for a set of 15 to 20 days. Second phase of treatment, we advised her with Sukumara Kashaya, Chandraprabhavati and Kanchanara Gugulu. Third set of treatment, we just focused on giving her with Pushpadhanva Rasa and Leptadine post-ovulation. So infertility post-thyroidectomy with ART failure aligns with again Agni Mandya and Apana Vaigunya driven Samprapti, leading into Nidana-based phased Ayurvedic intervention successfully restored the reproductive milieu. This case demonstrates again the role of Ayurveda as a functional terrain corrector, enabling conception even after the failed ART cycles.
Thank you.
Thank you, sir.
You have mentioned about mosaic embryo in the first case. And subsequently, after the conception, have you checked your ultrasonography?
Yes, sir. Yes, sir. So currently she is in her 5th month of pregnancy, sir. Her level 1 scans were done, including beta HCG and PA-PPA at 11 weeks, which was normal. And we also underwent with an NT scan. That is also come as NT scan was less than 2.1 mm, which is normal. Anomaly scans has been done and it is normal, sir. As of now she is in her 5th month. And currently she is doing an integrative approach with Ayurvedic medicine and also with an allopathic obstetrician.
One another question.
Yes.
You have mentioned about the Agni Mandya correction and Amapachanam, Anulomanam medicines.
Yes.
Okay. Besides this medicine, any that is Kriya Karmas done?
No, sir. She has not undergone any Kriya Karmas. Actually, that was a plan in process for her. Initially, we just gave Deepana Pachana for her and then planned, I had in mind to go with the further follicular scans and all. I think even after the simple Agni correction itself, we were able to see the conception in a span of 3 to 4 months itself.
Thank you.
Thank you.
You should come out in future because you are a
Yes.
teaching faculty, Prasudi Srirag, I believe. So in coming sessions, you have to come with more number of clinical trials.
Sure, we'll do that, sir. Thank you, sir.
I now invite Dr. Vishnu Priya for her presentation.
Namaste all. My topic is, myself Dr. Vishnu Priya Tangachan, Rajana Sharirya, 3rd year MD scholar from National Institute of Ayurveda, Jaipur. My topic is role of Ayurvedic dietary principles or Ahara in mental health, a holistic perspective on gut-brain axis. Manashaririyor tabam paraspara manuvrajeta, adhara adheya bhavatva tapta ajya ghadayoriva. This is a beautiful sloka which shows the connection between mind and body. And Chandogya Upanishad also says, Annamayam hi saumya manaha. We are what we eat, actually mind. So gut-brain axis is a bidirectional communication between CNS and enteric nervous system, which is actually the second brain. And it is actually heavily influenced by gut microbiota. So here we are assessing the relation between Ayurveda Hara and microbiota gut-brain axis. Currently, instead of calling gut-brain axis, now they are calling it as microbiota gut-brain axis, so as to help the psychosomatic disorder management. So, in Ayurveda aspect, Ahara Matra, Ahara Kala, Anna Kala, Trigunatmaka Ahara and mindfulness. These are the factors helping the good digestion. Matra, we know, for Laghu and Guru, it should be specific. Ahara Kala, when the Vishuddha Udgara comes, Prasushte Vinmutre, like that, following the Vidhi Niyama and Kala. These are said by Ashtanga Hridaya Sutra. And Annakala, in Ayurveda Rasayana commentary, it is shown as Yames Chadurbhi. For Ahara digestion, 4 hours. 4 Yama means 12 hours needed. So in one day we have 2 Annakala. And Trigunatmaka Ahara in Bhagavad Gita 17th chapter for Satvika, Rasya, Snigdha, Sthira, Hridya. Rajasa, Kattu, Amla, Lavana, Tishna, Tikshna, Ruksha, Vidahina. So Shadrasas also can be connected in this aspect. Tamoguna, Yada Yama. If 1 Yama is over, nowadays we are eating even for 1 week, especially bachelors prepare 1 week food also in the weekends. And we are keeping it in the refrigerator. And again we are heating it. That is again Ama. And Pudi Paryushidam, old food and Uchishtam. These all are coming under this. And mindfulness, Tanmana Bhunjida. And also we will discuss Ahara Vidhi Vidana. There also Acharya says Tanmana Bhunjida means, slide is little bit lower. Idam mama ubashede, idam na ubashede. Means when we eat, whether it is needed for me or not needed. It is Tanmana Bhunjida, mindfulness in having food. And Ishtadeshe Ishta Sarvopakarana. This is also to prevent Manovikhada. It shows the role of mind in digestion. And here also Ushnam Snigdham. Snigdham is again, we saw it in the Satvigahara. These all are mentioned in the Ahara Vidhi Vidana also. And considering the ama and other causes other than the matra, dushta, if we eat whatever we don't like by the force of someone else, it causes ama. And dagda, especially tandoori chicken, tandoori roti, these all items. And ama, especially uncooked, which are not in Agni Sannigarsha prepared, especially smoothie items, overnight soaked oats, these all are uncooked. And atyambu pludam, it is also smoothie and overnight oats, these all are atyambu pludam. And upadattayana bhuktam, means mental status of the cook also mentioned here. And these all are food. And at the same time, tribhala, dadi, takra, fermented food items like idli, dosha, these all helps the gut microbiota. And samashanam, madhyashanam, vishamashanam, viruddhahara, heenamatra, adimatra, and unhealthy samskara, processing method. These all affects the agnibala and grahani, which causes ajirna and ama, thus rasadushti, and mana is affected, which is ojas is also affected. And Shadrasa also we can connect. Means the second column only mentioned in the Ashtanga Hridaya Sutra. From that we can, correlating with the Bhagavad Gita, we can derive that Kattamla Lavana or Rajasa, Tikta Kadu, Kashainda less than order, greater than, like that. And Lavana Amla Madhura Kosa Satviga. And these are karmas also we can mention. Snigdho Hridya, these are Amla, these are mentioned in the Satviga. And Ashta Vidhi Visheshayadana also. Here also Karana, Samskaram. In Manthana, classical example is Dadi. Nowadays we can connect mayonnaise, which is actually emulsion, which is Guru and Pichila. Again it affects the other. Again, Desha, or under that we can consider refrigerator, which is Shita Ruksha, which causes Vada Kopa, and again Ama. And connecting with the microbiota gut-brain axis, it is a neuroendocrine pathway. Vagus nerve actually plays a major role in connecting this. When emotional stress is there, amygdala, hippocampus, lipping system is affected. It sends cortisol releasing factor, pituitary, then ACTH is released. Thus cortisol interacts with the intestinal targets, which again afferent and efferent pathways are affected. When intestine is affected, motility and permeability is also affected. Further, enteric microbiota is affected. Actually, this enteric microbiota releases serotonin a lot. Here, that is also affected. Again, it goes to the mind. So, this is the loop. And especially in autism, dysbiosis is a cause. It is a factor happening there. And anxiety, depressive behaviors, IBS, and gastrointestinal disorders are also connected with this. And here we conclude that all the factors mentioned like this reaches to gut microbiota. Causes Agnimandya or Grahani is affected. In IBS also we can see the symptoms of Grahani. Also etiology, stress is a major factor in IBS. So it reaches to Rasa Dushti. Rasa is actually Tushti Prinanam Rekta Pushti Bistu Rasaha. Tushti is Mana Praharshanam. So mental factor, mental health is affected. Again, it goes to gut microbiota, and that is the loop. So here we conclude that by following the Ahara Vidhividhana, Annakala, Trigunatmaka Ahara, Shadrasam, Madhuraprayam, all this we can make the gut microbiota properly, and thus we can help in the management of ASD, IBS, anxiety, depression, or any other psychosomatic disorders. So, and modern concept of microbiota gut-brain axis also supports this. These are the references. Articles are also available on this. Thank you.
Thank you. This is your hypothesis.
Yes, sir.
You can add some more herbals in this, no?
Some more?
Herbals and foods products and all you can add, which is good to the gut.
Sir, I think when we say the checked the articles, proven results are seen only based on curd, triphala. Yes. Triphala also is there.
Yes.
But when I observed again hypothesis, I think almost all the Deepanapajana drugs that mentioned by Ayurveda leads to correction of the gut microbiota.
Yes. That you can include.
Yes, yes. Yes.
That's good. Thank you.
Thank you.
Now I invite Dr. Ganesh for his presentation.
Good morning to respected delegates. Myself, Dr. Ganesh V, second year Shalidandra, she is Jaina Saraswati Ayurveda College. Today I am going to present a case study about therapeutic role of Joisma gel in the Parikarthika. Nowadays, Parikarthika means longitudinal tear in the distal anal canal. So, lot of nowadays fissure is correlated with Parikarthika. And the incidence of fissure is almost 18% all over India, and 38.2% has increased in Tamil Nadu itself. So, we should focus on this Parikarthika. And in Ayurvedic treatment, we are giving a lot of cures, more than 85% of Joisma gel we are using. In that, we are getting good results in that. To aim is to study the effect of Joisma gel in the management of Parikarthika. Objectives to evaluate the effect of Joisma gel as external application in the management of pain and burning sensation in the Parikarthika. This is the descriptions of the Joismadi. Is as a Panja Katutikshna Rasam and Gunatikshna Singna Sararasam, Virya Ushna Viryam, Vipakadu Vipakam, and the balance is Vadan Kafam, and Karma, Kandugram, Varana Shodhanam, and Veda Stapanam, Deepanam, Anulomanam properties also is there. And modern properties, antidepressant and analgesic effect also is there. And anti-inflammatory, wound healing property also promotes that, and antibacterial effect. The reference also we are taken from Kayadeva Dingundu and Dhanvantari Dingundu in Ranadiya. This is the case study of 32 years female, the patients came to our OPD, complaints are still associated with burning sensation in the perianal region during the defecation for 1 month. The pain was severe, and continuously 4 to 5 hours after defecation, the pain is severe, is present. So she took temporary allopathic medicines for laxative she took, and they get temporary relief. For further management, she came to us. The pain and burning sensation and spin tone was normal, and personal history was no habit and addiction is there. Vitals also normal. On per examination, interval fishes 6 o'clock and 12 o'clock 2 fishes are commonly presented. This is the therapeutic interventions. Following the patients, patient reports pain and similarity and experience in the verification. The vascular scale we had taken was subject to sufficient quantity of Joisma gel was applied and direct over the fisher side. After application of, before application, the pain vascular of 9 is there. After immediately after application of 1 minute itself, we have seen the drastic pain management in the vascular is reduced to 7 and 5, and within 10 minutes it has reduced into vascular is 4. Discussion, the study conducted on the case demonstration promises results in the application of Joisma gel. Therapeutic properties of Veda Stapana Suna Varana Shodhanam, and which is highly management of Parikarthikam. A topical application of Joisma gel was expected to reduce pain and burning sensation and promote fast healing. Observation, participants reported marked reduction in pain and burning sensation, and short duration application improved wound healing also. In turn, the results highlights the potency of Joisma gel as a cost-effective, patient-friendly, and alternative in invasive procedures. Conclusion, the gel effectively reduces pain and burning sensation, promote wound healing. This finding suggests the Joisma gel may serve as a safe, cost-effective, and patient-friendly alternative in our conventional treatment. However, large-scale radiation control trials are required to validate the efficacy and establish standardized clinical promotion, which will be done in future upcomings. This is my reference, and I sincerely thank my patient who trusted me and gave full support for me. And my professors, Udakin sir, Vasudev Reddy sir, Bala Subramanian sir, Venkatesh sir, and Rangavatmi ma'am, to valuable support for take the patient. Thank you.
Thank you. What are the ingredients in Jyotishmati gel?
Single drug, sir. Only Jyotishmati seed extract only we are using, sir. Single drug.
Jyotishmati Thailam or Jyotishmati extract?
Extract is mixed with gel.
Gel form. And you have done this study
Yes,
in
sir. Pilot study I have done for 5 patients. This is a single case study I have taken. There's a drastic improvement in that. I'm going to do a thesis on this. My thesis is related to this only, sir.
What about the internal medicines?
No, sir. I'm not monitoring without no internal medicines. Only this external application only.
Because Fisher is very common nowadays.
Yes.
So you can include the numbers more to support your study.
Sure, sir.
Thank you.
How much ml you will using inside?
Sir, minimum per rectal 3 to 5 ml we are using. So mostly, however you apply, the absorption will be maximum 2 to 3 ml only. So maximum we are applying for 3 to 5 ml only per sitting.
Good.
Thank you, sir.
Thank you. With this, we come to an end with the PG session.